Hello and welcome to this Ausmed session on dementia and pain, a practical approach. This lecture is for anyone who is interested in learning what and how pain is perceived and exhibited by someone with dementia and how to provide support. This is one of the 5 sessions in the series, specially formulated to discuss in detail how support providers can improve their skills and knowledge in this regard, as the needs of the person will continue to increase and often will be needing more time to be cared for with empathy and understanding. In this session, we'll review dementia and pain. We'll also look at signs and causes of pain and discomfort and learn helpful strategies to support and manage pain. Together, let's review. According to Dementia Australia, dementia is not a single disease, but rather a group of signs and symptoms brought on by brain problems that interfere with a person's ability to think clearly, remember things, and behave appropriately in daily life. This condition is typically long-term, degenerative, irreversible, and progressive. Following are some guidelines that we should follow. 1. Dementia is not a natural component of aging. It is a medical sign. 2. No two people with dementia have the same dementia experience. 3. When symptoms first start to show up, a medical diagnosis is necessary. And last, people often lead active and fulfilling lives for many years after their diagnosis. Now, once we have reviewed what dementia is, let's understand what is pain. According to PAIN Australia, pain is an unpleasant feeling causing a reaction to protect the part that is painful. Everyone who has experienced pain knows what it is, but everyone's pain is different. Many different factors affect an individual's experience of pain, and the exact contributors to pain are also different between individuals and between situations. One of the defense mechanisms through which our body keeps us safe is through pain. The brain receives information from danger detectors in the body, and depending on the information it receives from other sources and its own prior experiences, it may or may not produce pain. Through complex neuronal systems, psychological, social, and physiological elements can all have a significant impact on how pain is experienced. Pain can be acute or chronic. Acute pain comes on suddenly and may be due to an injury or infection. Acute pain generally eases as the affected body part heals, or potentially the pain-causing activity is stopped. However, chronic pain is persistent over time and may be due to an underlying long-term medical condition such as arthritis. The pain may be present all the time or may come and go. Is pain experienced differently in dementia? Earlier, it was believed that people with dementia don't feel pain due to the damage occurring to their brains. However, research has shown that this is not true. A study conducted in Melbourne using functional magnetic resonance imaging (MRI) revealed that people with Alzheimer's disease showed pain-related brain activity in the same brain regions as those without Alzheimer's disease, concluding that people with dementia feel pain in exactly the same way as those without dementia. The problem they have is trouble explaining it to others. In addition, it is important to understand that changes in the brain that occur in different forms of dementia do not cause pain. People with dementia are more likely to experience pain because they are also more likely to experience other pain-causing events, including falls, accidents, and injuries. Additionally, a variety of medical conditions that might cause pain or discomfort are more common in older people in general, including those who have dementia. According to Dementia Australia, people with dementia may experience physical pain for the same reasons as everyone else. However, because of their declining brain function and abilities, they may be less able to communicate to their carers that they are in pain. People may still be able to communicate their pain verbally in the early stages of dementia. The most obvious way to find out if a person with dementia is in pain is to ask them. They may not be able to describe where the pain is coming from, and even may say no if you ask if they are in pain. It may be helpful to ask them specific questions such as, is your arm aching? Or does it hurt here? Etc. However, when their cognitive abilities decline, their diminished cognitive abilities and communication skills may make it difficult for them to appropriately describe the type, intensity, and location of their pain, or to remember to take their painkillers on a regular basis, which leaves them in pain for longer periods of time, often followed by frustration, aggression, and anxiety. Especially in the early stages of dementia, older people may be less likely to report their pain for a variety of reasons. Some of these include depression, anxiety, and fear about needing a surgery, being admitted to the hospital, or being sent into a residential care. Sometimes the misconception that all painkillers are addictive and the desire to avoid appearing weak or complaining can all cause someone to underreport their pain. Differences in gender, culture, and religion can also influence how pain is perceived and reported. Many people with dementia may lose their ability to verbally communicate their discomfort to others, especially in the later stages of the disease, as we mentioned before. Observing for nonverbal cues can be useful in determining if pain in dementia patients at all stages is present. They can include grimacing faces, distressed-looking gestures, guarding a specific body part, or a reluctance to move, moaning while moving, restricted range of motion, or slow movement, increased heart rate, blood pressure, sweating, restlessness, crying, distress, withdrawal from social interactions, disrupted sleep, decreased appetite, etc. The pain assessment in advanced dementia scale, PAINAD, was developed to assess pain and reduce the likelihood that it is under-recognized and under-treated. It's easy to learn and use by people without prior medical training and does not require the person with dementia to have language skills. Please click on the QR code to access more information. As discussed before, people with dementia may be at a higher risk of poor pain assessment and expression. Therefore, it is best that pain management is interdisciplinary. Once it has been identified that a person with dementia is experiencing pain, they should generally be seen by a doctor who can determine the best treatment options. If medications are prescribed, make sure they are administered and taken and restocked regularly. Pain in dementia can be managed and controlled with the help of both pharmacological and interdisciplinary non-pharmacological pain relief. Gentle exercises to relieve stiff joints, massages to relieve tight muscles can help. But seek advice from a physiotherapist on the best and safest techniques to use. Some people benefit from using heat packs. However, be careful that they are not overheated, they do not irritate the skin, or they are not too hot, or they are not used for too long. Help position the person so that they are comfortable in bed or in a chair. Use an air mattress and air cushions to relieve pressure. Help support the person with good mouth care and oral hygiene, and ask a dentist for advice where there are problems. Distractions, relieving boredom, a calm, comfortable environment, social contact, treating anxiety, and depression can all help to alleviate pain. As care providers, you can play a crucial role in effectively assessing and advocating for the pain management of the person with dementia. This acronym ALTER may come in handy. Have a look. Letter A, anticipate. Expect that your loved one with dementia will experience pain at some point. Be proactive early in the disease process to help ensure pain is not left untreated. Familiarize yourself with PAINAD scale. Be prepared to advocate for your loved one through caregiver education and physician visits. Review advocacy tips. Letter L. Look. Watch for some common causes of pain. Look, touch, listen, and think about the different types of pain your loved one may be experiencing. Inspect your loved one's mouth for oral sores due to decay or ill-fitting dentures. Inspect feet for skin lesions or issues from ingrown toenails. Do you see your loved one wince or guard against gentle pressing their abdomen? Feel large joints like knees and hands? Do they feel warm or is one swollen? Does your loved one appear more comfortable in certain positions? Look for these. Letter T, treat. Review non-medication treatment options and incorporate these into your care. Bring music from their youth, massage sore joints, or color together. Talk with the healthcare team about any concerns and if medications are necessary. A. Avoid comparisons. It's easy to compare your loved ones today to their past selves. This is not helpful and should be avoided. People with dementia don't process pain in the same way they did before their diagnosis. Your loved one may have bragged about having a high pain tolerance in the past, but it is experiencing pain differently now. Medications and other treatments may be necessary. Lastly, letter R, revisit. Treatments that might have worked last week may not work today. A few good days does not mean that the pain is under control over the long term. Consistently revisit the types of pain, treatments, positioning, time of the day, and other factors affecting your loved one's pain. To summarize, pain in dementia is not a behavior in itself, but may lead to behaviors due to lack of assessment and poor management. Therefore, effective, empathetic, affectionate care and management by the support providers is extremely crucial. Thank you.